We began the Edmonton protocol treatments in 1999 and published our first findings in 7 patients, all of whom were able to stop taking insulin in 2000 in the New England Journal of Medicine. And those patients require cells that are extracted from a brain-dead organ donor, the same organ donors that provide hearts, lungs and livers for transplant. These pancreatic progenitors don't turn into islets until they're transplanted into a living being. So when we transplant those into mice, they transform. It takes about 2 to 3 months, and then they become insulin-producing cells. By adding the growth factors, they've sort of been kicked along their way in a certain path. Mm-hmm. And once they're in that path, when you transplant them, they continue in that path and they develop. It begins, as I mentioned, step by step. Eventually, we'd like to treat everybody with diabetes, but we can't start that way. And ViaCyte and ourselves are working together on all these different approaches to see how we can best optimize cell survival.
Since I first got diabetes, they've been saying the cure is 5 years away, 5, maybe 10 years away. And they've made huge leaps and bounds, but we're not there yet. And I thought it would be really exciting to be able to play a role and help further that cause along. The devices they put in my body are called Sentinels. They're about the size of a credit card, about half the width and about half the depth. They saturate these with stem cells. They then implant them in my body. They implanted 2 smaller ones in my forearm, 4 smaller ones in my abdomen, and 2 larger ones on the side of my abdomen. They're designed to protect the stem cells inside them from my autoimmune response, which would be to kill anything that produces insulin. It would be amazing. The freedom alone would be remarkable. The biggest concern I think type 1 diabetics have is the constant monitoring of the disease. The idea that we would be free of that would be amazing. Any diabetic you ask, it's the ultimate full-time job. You're constantly thinking of it. Every few minutes you're thinking to yourself, where's my sugar at? How am I doing? How am I feeling? When am I eating next? That's constantly rolling through your head because it has to. So the idea you could be free from that is almost beyond belief.